The Nicotine Patch Patch, Transdermal 24 hours is a medication that can help you quit smoking by replacing the nicotine in cigarettes. Nicotine is an important part of cigarette addiction, and when you stop smoking, your nicotine levels drop quickly, which can cause withdrawal symptoms like craving tobacco, nervousness, irritability, headache, weight gain, and difficulty concentrating. To increase your chance of success in quitting smoking, it's best to be ready and committed to quitting. The nicotine patch, used as part of a total stop smoking program that includes behavior change, counseling, and support, can help you in this process. Stopping smoking is crucial for improving your health and living longer, as smoking is linked to lung disease, cancer, and heart disease. The nicotine patch should be used according to the recommended dosage and timing for optimal effectiveness. When using the nicotine patch, be sure to carefully read all the directions on the product package or the patient information leaflet provided by your pharmacist. Start using the patch on the day you plan to quit smoking. Apply the patch to a clean, dry, non-hairy area on your trunk or upper arm, and press firmly to ensure it stays in place. Wash your hands with water after applying the patch, and do not use soap. The best dose for you is the one that reduces your urge to smoke without causing side effects from too much nicotine. Your doctor will prescribe the appropriate dose based on your smoking history and medical condition. Different brands of nicotine patches contain different amounts of nicotine and have varying instructions for how long to leave the patch on the skin. Consult your doctor or pharmacist to determine which brand and duration is best for you. Do not apply the patch to irritated skin or over other skin products, and do not wear a patch for more than 24 hours. Use a new patch each day at the same time, usually when you wake up. After several weeks, you will gradually lower your dose until you no longer need nicotine replacement. It is important to complete the 8 to 10 week treatment period with this medication. If you still feel the need to use the patch after this period, talk to your doctor. If you suddenly stop using the patch, you may experience withdrawal symptoms such as tobacco cravings, nervousness, and irritability. Your doctor may lower your dose slowly to help prevent withdrawal. If you have not been able to quit smoking after using the patch for 4 weeks, talk to your doctor about alternative options. Many people are successful in quitting smoking after multiple attempts. If you experience mild itching, redness, burning, or stinging at the application site, stop using the nicotine patch and consult your doctor if the redness does not go away after 4 days. You may also experience nausea, dizziness, flushing, heartburn, or headache. When you stop smoking, common nicotine withdrawal symptoms such as dizziness, anxiety, depression, or trouble sleeping may occur. If these symptoms persist or worsen, seek medical advice. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects, but it is more likely if you continue to smoke while using the patch. Stop using the patch and seek medical advice immediately if you experience mental or mood changes, numbness or tingling in hands or feet, or swelling in the hands, ankles, or feet. In the event of serious side effects such as chest pain, confusion, severe headache, fast or irregular heartbeat, trouble speaking, or weakness on one side of the body, stop using the patch and seek medical help immediately. Although rare, if you experience symptoms of a serious allergic reaction, such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help. This is not a complete list of possible side effects, so consult your doctor or pharmacist if you notice any other effects. If you are in the US, report any side effects to the FDA, and if you are in Canada, report them to Health Canada. Before using the nicotine patch, make sure to inform your doctor or pharmacist if you have any allergies, especially to nicotine or adhesive tape. It's also important to discuss your medical history, including any conditions such as diabetes, heart disease, high blood pressure, or skin problems. If you are planning to have surgery or an MRI test, let your healthcare provider know that you are using the patch. Additionally, it's important to avoid exposing the patch to direct heat sources and to talk to your doctor about the effects of exercise on the medication. If you are pregnant or breastfeeding, consult your doctor before using the nicotine patch. When using the nicotine patch, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Not all possible drug interactions are listed here, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to communicate with all of your healthcare providers about your decision to quit smoking, as it can affect the way your body removes certain drugs. This includes medications such as acetaminophen, caffeine, insulin, oxazepam, pentazocine, propoxyphene, propranolol, theophylline, tricyclic antidepressants, and diuretics. If the patch is chewed or swallowed, it can be harmful. If someone has overdosed, remove the patch if possible. For serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. Symptoms of overdose may include confusion, drooling, seizure, slow/shallow breathing, hearing problems. If your doctor has recommended the Nicotine Patch Patch, Transdermal 24 hours for you, it's important not to share it with others. If you happen to forget to change your nicotine patch on time, make sure to do so as soon as you remember. Then, you can continue changing your patch every 24 hours as usual. It's important not to double the dose to make up for the missed patch. Stick to your regular dosing schedule to avoid any potential risks. When using the nicotine patch, it's important to store it in the original packaging at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep the patches in the sealed protective pouch until you're ready to use them. Apply the patch immediately after removing it from the pouch and do not use it if the pouch is damaged, cut, or opened ahead of time. It's crucial to keep all medications away from children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the patch when it's expired or no longer needed, following the instructions in the How to Use section. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.